everyone, and welcome to ACHA's video on pulmonary artery hypertension. My name is Carla Deal. I'm ACHA's peer mentor coordinator, and I am joined by Dr. Tabitha Moe, director of the ACHD program at Honor Health, associate clinical professor at Medical University of Arizona, Phoenix, and associate program director of the Cardiovascular Fellowship at Honor Health. It's my pleasure to have you join us, Dr. Moe, to talk about pulmonary artery hypertension. And my first question for you is, what are the most common risk factors for adults with CHD to develop PAH?
Pulmonary artery hypertension comes in two general flavors. One of them happens on the heart side before blood goes to the lungs, so on the blue blood side of the heart. And one of them happens on the red blood side of the heart as blood has moved through the lungs and is draining back into the heart. The blue blood side risk factors include things like autoimmune disease. So, for example, lupus also includes things like, for example, high volume shunts. And the high volume shunts mean big holes or big communications between chambers of the heart that were not designed to have those big communications. So these are things like an atrial septal defect or a ventricular septal defect or a patent ductus arteriosus. So if those things are large and they continue for an extended period, the bigger they are and the longer they go on unrepaired, the higher the risk is of developing pulmonary artery hypertension. The second flavor, or the other flavor, which is the red blood side of risk, we call it post-capillary pulmonary artery hypertension. Those patients are much more likely to be older, more likely to have things like high blood pressure or hypertension. And this develops because the ventricle, which receives that oxygenated red blood back from the lungs, gets stiff over time. And so for patients who have stiff hearts, these are patients like patients with repaired coarctation of the aorta, Schoen's complex, which is multi-level left-sided obstructive disease, and patients with some other hereditary cardiomyopathies like LV non-compaction can end up with this post-capillary pulmonary hypertension.
Well, thank you for sharing those common risk factors. And now I'm wondering, what are the symptoms of PAH in adults with congenital heart conditions? How does that present?
Pulmonary hypertension is really tough because the symptoms overlap so much with other things. Common symptoms are things like breathlessness, shortness of breath with exercise. Sometimes it's a chest tightness or low oxygen levels, even low oxygen levels at rest, but much more likely to have normal oxygen levels at rest that decrease with exercise. Sometimes it can be holding on to extra water so that you have swelling of the ankles or the feet. So each of these symptoms is very non-specific for pulmonary artery hypertension. And so it's really important to stay in close contact with your ACHD team for screening. And ideally, you will be screened and you would be identified as having risk factors for PAH long before you ever have any symptoms of PAH.
That's helpful. Thank you. And what are the treatments for PAH in adults with congenital heart conditions?
The treatments for pulmonary artery hypertension differ depending on which flavor you have. There are different medications that we use for pre-capillary pulmonary artery hypertension than what we use for post. Pre-capillary pulmonary hypertension is treated with a multi-pronged approach. We use several different classes of medicines. Those classes of medicines include things like Viagra, which is also called sildenafil. Viagra is a PDE5I medication. That's the class of medication. The other medicine in that same class is called Cialis or tadalafil. They have other indications that you may also be familiar with. They're useful in erectile dysfunction. And the reason why we use them in both of those conditions is that they allow blood vessels to relax and fill. The second category of medicines are called endothelin receptor antagonists, or ERAs. Those are medicines like bosentan or ambrisentan or macitentan. The newest one is called Opsimet. The third category of medicines are soluble guanylyl cyclase inhibitors, and those are medicines like Adempas or Riosaguat. The fourth category of medicines is the broadest category, and it comes in medicines that can be taken by mouth, medicines that can be injected, medicines that can be inhaled, like via an inhaler, medicines that can be given continuously through a subcutaneous pump, like insulin pumps in diabetics. And that class of medicines are called prostanoids or prostacyclins. The oral therapies are things like selexipag or Orenitram. The inhaled medicine are medicines like Ventavis. And then those subcutaneous forms are things like Flolan or Remodulin. The post-capillary pulmonary hypertension are more common in older patients, and usually we use kind of the normal blood pressure medicines plus medicines like Jardiance or SGLT2I class medicines that help relax that ventricle when it's starting to get stiff.
Well, it sounds like patients have a lot of options that they can discuss with their providers, what would work best for them. Well, thank you so much, Dr. Moe, for teaching us about PAH. I learned a lot, and thank you to our sponsors, Johnson & Johnson and Johnson & Johnson MedTech for their support of this video through an unrestricted educational grant. And thank you all for watching. We hope to see you next time.